Good morning. Good morning to Radio Land. Good morning to Mama Liberia. Good morning to our viewers and listeners. Welcome back to today's edition of Health Talk. On today's edition of Health Talk, we are discussing typhoid. The Mama Lume Health Talk platform is a 1-hour program that discusses a wide range of health-related issues. It brings you face-to-face with health professionals and provides you with causes, signs, and symptom complications and preventions of diseases and illnesses affecting us in our respective communities. Our topic for today's edition is typhoid. Typhoid fever is a life-threatening infection caused by the bacterium Salmonella typhi. It is usually spread through contaminated food or water. An estimated 11 to 20 million people get sick from typhoid, and between 128,000 and 161,000 people die from typhoid every year. In December 2017, World Health Organization pre-qualified the first conjugate vaccine for typhoid. This new vaccine has longer lasting immunity than other vaccines, require fewer doses, and can be given to children from the age of 6 months. Liberia is a typhoid endemic country with more than 7,400 cases estimated per year. It is estimated that in 2016, there were at least 7,401 typhoid cases, which is 160 cases per 100,000. 84 typhoid deaths and 5,906 disability adjusted life years lost to typhoid. Most typhoid cases in Liberia occur in children under 15 years of age. So today, we will be discussing typhoid. We will talk about what is typhoid, what causes typhoid, what are some signs and symptoms, prevention and complications of typhoid. We'll be joined in studio shortly by Mr. Alfonso J. Jala. Mr. Alfonso Jala is a post-basic health sciences student at the Morapatin College of Health Sciences. He holds an associate degree of science in nursing and a prospective registered nurse. Next to him is Prince William Kona. Prince is a student from the Morapatin College of Health Sciences. He's reading his post-basic health sciences, and he's also going to be a prospective registered nurse so soon. He also holds a master. He also holds an associate of science degree in nursing at the Morapatin College, or from the Morapatin College of Health Sciences. To be part of the discussion plus more, the numbers to call are 0770 107 107 0886 107 107. You can call and ask our studio guests any questions pertaining or related to typhoid. And you can also call and share your experience on typhoid. So sit back, relax, and listen to this educated health talk coming to you just after a short break. I am Mama Lume, and this is Health Talk.
Begin at tunesliberia.com.
We are Project Liberia. Mama Liberia. Must all rise. Stand together. Fight the world. Security.
Indeed, what kind of world we live in? No security. This world is full of insensitive, as we are seeing around the world. There's a huge COVID cases or rebounds of COVID, and also in our neighboring country, we are hearing about coronavirus. But so interesting that that's not the topic for today. We are talking about typhoid. Maybe in our next presentation, we'll talk about current events in Liberia, especially concerning the health issue. So welcome back. On today's edition of the show, we are discussing typhoid. So we're going to look at what causes typhoid, what are some of the signs and symptoms, preventions, complications, risk factor, and support now. So if you listen to me earlier, I said we are discussing typhoid. To be part of this show, the numbers to call are 0770-107-107, 0886-107-107. I have with me in studio Mr. Alfonso J. Jala. Mr. Alfonso Jala, welcome to Health Talk.
Thank you ever so much. It's a pleasure being here today.
Thank you. And next to him is Mr. Prince William Kona. Mr. Kona, welcome to Health Talk.
Well, thank you for inviting me on your platform. Well, it's an honor to be here to discuss with you issues that are of health concern to our people in the country.
So thank you so much. And the line are not yet open. We're going to go into discussion a bit before we open the phone line. So please stay tuned. Don't touch that because today's topic is really interesting. So let me start with Mr. Jala. Alfonso. So today we are discussing typhoid. I think for all institutes, we already know what is typhoid. But for the benefit of the audience, for the benefit of our viewers, when we're talking about typhoid, what really do we mean? What is typhoid?
Okay, thank you so much. Again, it's a pleasure to be here and to discuss health-related issues, especially using the airwave to educate our people. Typhoid is one of the most common diseases in Liberia, and typhoid is a systemic disease caused by a bacterial infection. That is associated with fever. It's a disease that affects the human being. And this disease here is caused by agents, bacteria. And we have the Salmonella enterica serotype typhi. And we have another one called the Salmonella enterica serotype paratyphi typhoid. These two agents, they cause typhoid fever. But then the two of them, the paratyphi is less severe than the Salmonella enterica serotype typhi. The Salmonella typhi is most severe and it is most common in our setting.
So, Alfonso, we will come to that of the differences, but we were just wanted to know what is typhoid. So, before we eat our cake earlier, because these are questions that will come next, right? So, as you described, typhoid is an enteric disease, right?
Sure.
Yeah, because we either get it from contaminated food or water, right?
Yeah.
So, thank you so much. Let us move to Mr. Kona. Mr. Kona, so what causes this typhoid?
Well, as my colleague said earlier, typhoid is a bacterial illness, a bacterial infection, and the causative agent for that infection is the Salmonella typhi bacteria. Whereas, to be more specific, there are actually two types under there, and I think he discussed it earlier. There's Salmonella enterica serotype typhi, and there is Salmonella enterica serotype paratyphi. And the paratyphi form, though that it can cause typhoid too, but it's not as common as the typhi form of typhoid. So mostly the main cause of typhoid, especially in our setting, is the Salmonella typhi bacteria.
Okay.
Yeah.
So, especially in our setting, the Salmonella typhi is very common. Yeah, because that bacteria can be spread in order through fecal oral route, right?
Yes.
Okay. Thank you so much. Thank you. So, Alfonso, Can you please give us some signs and symptoms before we come to that differentiation of
Yes.
the Salmonella typhi?
Some signs and symptoms of typhoid is similar to other disease conditions that have to do with headache, have to do with vomiting, joint pain. Some people experience constipation. Some people have fever and other signs and symptoms. Yeah.
Okay, do you want to come in?
Yeah, in addition to that, some people may not be experiencing the constipation. Some people may actually experience diarrhea, and sometimes it can also it causes something called the rose rash. And these are rashes that will appear on the chest and sometimes other parts of the body. They have the color of rose, so they give them that name, rose rashes. But these symptoms, it's not all the time that everybody who comes down with the disease will experience all of them. Sometimes the person might experience a few. Some people, they might not even notice the symptoms at all. These are people we call asymptomatic people. So it's not possible, it's not always the case that everybody will come down with all the symptoms. Sometimes maybe 2 or 3 before the person will get diagnosed and treated.
Okay, so I heard you talking about headache, weakness, and some of these signs and symptoms are intertwined, right?
Yeah.
Because like today we are in a crisis called the COVID-19.
Yeah.
They got the signs and symptoms of COVID-19 almost intertwined with that of typhoid because they talk about weakness and fatigue.
Yeah.
And in COVID-19, weakness is also there, right?
Yeah.
Headache, fever. So all of these. So when you having these signs and symptoms, the only way you will know that this is a specific disease like typhoid or COVID-19, you have to go to the hospital for proper diagnosis, right?
Yes.
Then stomach pain, loss of appetite, weight loss, all these are attributed to coronavirus.
Sure.
So you will not just have stomach pain today, weight loss, and then you say you have COVID or you have typhoid. But when you go to the hospital, they do the necessary tests. That's the time you will get to know which one of the disease condition causing this particular weakness, causing the dry mouth, causing rashes on your skin, the extremely swelling of the stomach, all of this stuff. So the question is to you now. So how can we diagnose this typhoid? How can it be diagnosed? Anyone can answer that question.
Yes. In order to diagnose typhoid, you have to go to the hospital. And there they're going to do a test on 3 main specimens that has to do with the stool, which is the feces or toilet, as common people call it. You have the blood, you do the blood test, and you also do the urine test. Within 3 specimens, there where they can find the bacteria that affects that particular individual. But then the most common test that is done in Liberia is the blood, due to sophistication in laboratory equipment.
Okay.
Yeah.
Okay, let me just come in there. Basically there are 3 or there are 2 main types. We can do culture, or we can do a DNA. They can do a test to detect the DNA of the bacteria to show that the person actually have it. And in culture, they can do stool culture or blood culture. But then here in Liberia, we have very limited access or very limited source of laboratory equipment. So to be able to do a full blood culture or stool culture for a patient that has this disease, to be able to really detect if they actually got it, sometimes can be very difficult because of our own limitation. Well, yeah, what we can do here mostly, we have like Makuri was saying, we have the water test, which is there to do basically to detect the serum or the DNA of this actual bacteria within the person. I will detect, and it's a very, very quick. It's not as reliable as the culture test, but it's very, very fast, and then it's not very as expensive as compared to the culture.
Okay, thank you very much. Thank you so much. So all they just trying to say is an enteric disease. So when you want to diagnose this type of disease, you just have to check for that 3 main important thing, right? The stool, the blood, and then and then what?
Urine.
The urine. So you have to check to make sure where it is. But actually, it's embedded in the stomach, right?
Yes, sure.
Okay. Thank you so much. So now we are going to open the phone line to entertain some calls and then continue with our discussions. The numbers to call to be part of this show are 0770-107-107, 0886-107-107. So you can start placing in your call now. We're discussing, a lot of calls coming, but I couldn't answer it because we just started the show. So now you can start calling us on the number 0770-107-107, 0886-107-107. So Alfonso, you were talking about the different type of salmonella typhi. So can you just brush over if while we're waiting for our callers?
Yeah, so my colleague also spoke of that. The two main types of salmonella typhi that has to do with the salmonella enterica serotype typhi, and then the salmonella enterica serotype paratyphi typhoid. Like I said, the paratyphi is less severe. That is, if someone has it, it's not that severe as compared to the salmonella typhi. And the paratyphi is not common as compared to the salmonella typhi. And the salmonella typhi is most common in our setting and is most severe.
Okay. So the numbers to call are 0770-107-107, 0886-107-107. You can call and be part of this discussion. You can call and share your idea on typhoid. If you've been diagnosed with typhoid before, what are some signs and symptoms that you experience? So you can call us and share your knowledge. Good morning, your name and where are you calling from?
My name is Anthony Williams. I'm calling from Virginia.
Your name again?
Anthony Williams. I'm calling from Virginia.
Yeah, Mr. William. Welcome to Health Talk.
Yeah, I'm a patient. What I really want to know is there any medicine that can cure this typhoid that when I take it? And it's 2 or 3 months down, it starts again. So I just want to know if there's medicine that can stop it.
All right, thank you so much. Thank you for calling. Keep listening to the show. Yeah, you were saying something, right? One of our callers were asking, but we will come to that because we don't want to jump. We'll come to treatment and the prevention aspect. Yeah. So the numbers to call are 0770-107-107, 0886-107-107. You can call and be part of this discussion. You can call and share your idea on typhoid. So can we move to the risk factor when we receive caller and then we entertain the call? So can you give us some risk factor when it comes to typhoid?
Okay, for risk factors for typhoid, well, it's an enteric disease, so you can, people who are in an overcrowded place, for one fact, it's very, very easy for that disease to spread among them. That's one risk factor. Another one is if you live in an endemic area, that means if you live in a place where typhoid is common, you are also at risk for coming down with typhoid. And then also people who live in communities that have very, very poor sanitary conditions. These people are also at risk for coming down with typhoid. And also people who practice, poor hygiene, poor food hygiene.
Good morning, your Jimmy. Where are you calling from?
I'm healthy. I'm calling for people.
Yeah, Nancy, welcome to Health Talk.
Yeah. The discussion typhoid, I experienced some symptoms. Always, I don't know. It means that and symptoms. Hello?
Yeah, I'm there.
Yeah, I experienced my body. Sometimes I get weak in body, my heart can, and then when I feel, I lost appetite.
Okay.
For each one can get a symptom like that. Because one of my hepatitis told me that every time I see that, I should buy garlic. but each time I drink the garden water, I can feel normal. Yeah.
Okay. Thank you so much. Thank you for sharing your experience with us, and they're just going to lecture on that. Keep listening to the show. Thank you.
Thank you.
So this is interesting, right? Like, because we gotta talk about this because already past our signs and symptoms.
Yeah.
He's talking that he is a typhoid patient or he been experiencing typhoid for the past time. Like each and every time when he have the symptoms, a herbalist told him that he should drink the garlic or mash the garlic and put in water and drink it and he feel released. So what's your thought on that? I'm coming here first. We got a call. Good morning, your name and where are you calling from?
Good morning, I'm Secretary. I'm calling from Barnum.
You are?
Secretary, I'm calling from Barnum.
Yeah, Kevin, welcome to Health Talk.
Thank you. Okay, what I want to know is what are those abilities you can give out to stop the widespread cycle?
Thank you so much. Thank you, Kevin. So we discuss that. Just keep listening to the show, yeah?
Okay.
So you were saying something, Alfonso?
Yes, pertaining to the comment that the previous caller just made, especially concerning signs and symptoms, and he using Gale for treatment. You know, Gale is very good when it comes to it's a natural herb that can be used for treatment. But then we as scientists, we believe that whenever you have a sign and symptoms of a disease condition, even clinically, we advise you that you go to the hospital to do a proper checkup. Reason being, like we previously said, there are other disease conditions that can cause this,
Of course.
the sign and symptoms. They are similar. So therefore, you as an individual, you can't just assume that, oh, because I'm feeling headache or my joints are weak, so it means I have typhoid. So I need to go and get certain medication to take. That is wrong. Our advice is that go to the hospital to do a proper investigation and they will find out what is causing that symptoms.
Because all of the signs and symptoms are intertwined.
Sure.
And probably you may be feeling weakness and lack of appetite can also be malaria,
Sure.
right?
Sure.
It can be typhoid, it can be COVID, it can even be Ebola, right? So these symptoms are intertwined. Anytime you experience the symptom, what you have to do, visit the health center first. Call your doctor or visit the hospital. If they see how best, they can help you out. If the hospital fail, then maybe that's the time you go to your herbalist. But we really need to set this awareness out. Then one of the callers was saying, what are the awareness we can do to stop the spread of typhoid? So we will reach there on the prevention aspect. Let us go back. You were talking about the risk factor issues. And Alfonso, so what are some complications when it comes to typhoid?
Okay. Knowing that typhoid is injected through orophageal route, and whenever you inject that particular bacteria, it goes into the intestine. There in the intestine, it try to manipulate and enter into the bloodstream. When they enter into the bloodstream, it's looking for a target site. That is a place where it will go to sit. If it goes into the liver, into the spleen, or it goes into the joint, there it starts what the cause or complication. And some complication has to do with liver problem. Typhoid, chronic typhoid can cause intestinal perforation. It will cause hole on the intestine. It will also cause enlarged spleen.
Okay, thank you. So you want to come in?
Yeah, I just wanted to add up small to what my colleague said.
1 minute we got a call. Oh, we lost that caller. Another one.
Okay, there are so many different complications that are associated with typhoid disease or typhoid fever, but the most common one is the intestinal perforation, which is basically saying that the typhoid infection has caused a lot of small holes to come in the intestine, and then sometimes through the host, some intestinal contents can spill into the body, and then it can start to cause further complications like peritonitis, which is inflammation there, or start causing damage to the peritoneal lining. But there are also some that are less common. For instance, you can have myocarditis, you can have endocarditis, you can have pancreatitis, you can even have lungs problem. There are a lot of these are less common ones, but they are also worth mentioning. But the most common one is the intestinal perforation.
Okay. And one of the complications can even be meningitis, right?
Yes.
Inflammations of the membranes and fluids surrounding your brain. And you know, Himo, our brain play a key role in our life, right?
Yeah.
Without the function of our brain, everybody would be dead.
Yeah.
So like that's one of the main complications too. So the one of the caller was saying, what can we do, or what are the awareness we can do to stop the spread of typhoid?
Yeah. Yeah, so for awareness, basically we just encourage people to take the preventive measures, which include: 1, practice safe food and drinking habits. That means you take care of your food, take good care of your water. 2, put into place good sanitary habits, or try to clean your environment. Make sure that you maintain good sanitation in the environment or in your community. And then your own personal hygiene, it can also be a way to help you prevent yourself from getting typhoid. And then another thing again, I think we should also add here is the fact that we should not just stay home and do self-medication. I think it's also contributing to the spread of that disease, because if you stay home, you start to put yourself on medication, you go through the treatment. Most of the time we don't even complete the treatment, and by the time we start to feel well, we feel that the disease is no longer there. And then in fact, that's the meantime the disease can have the bacteria can have time to even go and cause further damage. And when we reach a certain point and no other medication can be able to help the person, and then it can cause a lot of problems. So let us start to put aside that self-medication aspect and always try to seek professional help. It's very, very important that you seek professional help so that we can be able to distinguish what disease is causing your symptoms.
So thank you so much. It is always good to visit the hospital or the health setting to know what actually happening. Then buying the OTC drugs, the over-the-counter drugs. Please stay away from that and always visit the health center. So Alfonso, in my introduction, I said in December 2017, World Health Organization pre-qualified the first conjugate vaccine. So can you tell us a bit about the type of vaccines?
Yes, the typhoid vaccines have been established, and most basically the typhoid vaccine is given to people who are like traveling. There's about 2 weeks to travel time to give it to you. Besides that, where typhoid fevers or crisis is, you also immune people with the vaccines at least for 2 years.
Okay.
Yeah.
Okay, yeah, that's it. Actually, the vaccine is given in 2 different ways. One is given as a single shot, at least 1 week before you travel, like what he was saying, and the other one is given orally in full capsule, which can be which one capsule can be taken every day or every other day, at least. So to be part of the discussions, then you must call at 0770 107 107 0886 107 107. So looking at you from Mother Patin, I know you have a lot of experience. What are some of the challenges when you were at the clinical site as a student nurse from Mother Patin? What are some of your challenges when it comes to these cases in Liberia, especially typhoid?
Well, I think I already mentioned one of the challenges that we have in our clinical practice, and that is people practicing self-medication. They will buy, I think every one of us to some extent have been in it before. They will get sick at home, will take the medicine without any via or by any professional or prescription. We buy the medicines, we take them. Sometimes we don't even complete the full treatment. As soon as we start to get well, to feel well, we feel that the sickness is no longer there. Now, the symptoms of a specific disease can be absent, but it does not mean that the disease is no longer there. So most of the time when these things happen, when the case get chronic, to the point where when you reach the facility, there's not much that can be done. It's a serious challenge for us because you see somebody, you want to help the person, but then there's not much that you can do in your country or within your own capacity to help that person. Why? Because the person has already stayed home. The time is supposed to come to the facility for treatment, the time is supposed to come for help, they have already exhausted much of that time. By the time they come, there's not much that can be done that you can do within your own capacity as a nurse.
Okay, Alfonso,
Yes.
what support do you want to learn now?
Yes, I want to add up.
Okay.
Some of the challenges that we have as a clinician in the various clinics and hospitals, most time our clients, they will come with their complaint. We diagnose them with the disease condition, like for typhoid, and for every disease has a treatment plan. There's some disease condition you treat, you go for 7 days, you go for 14 days, and all this stuff. And mostly for typhoid, you treat it for 7 to 14 days. And there are some of them will come, the health education will be given to them, they will take the medication home, but then they will misuse the medication. Because medication that you take from the hospital for your condition is for only you. And timing in medication is very important. So there are many people that misuse medication. If they go home, they can't take it on time. That's number one, which might cause relapse in the typhoid fever. And there are some of them, they're supposed to take it for 14 days, but they might not even take it as they're supposed to do it. So those things they were our challenges, or they are our challenges in a health setting. You get the health education, but then when the person leaves the facility, they do their own thing.
So in my introduction, I said most typhoid cases in Liberia occur in children under the age of 15 years of age. What message do you have for them in the end of Liberia?
So, children, they are at risk of typhoid fever. For one fight.
Good morning, your name and where are you calling from?
Anthony William again.
Yeah, Anthony William. Welcome back to Health Talk.
Is it our diagnosed with typhoid and you just, let's say, 1 week ago, and the doctor gave me 10 strips with 5 injection in my vein. But he didn't prescribe me other treatment again. So I'm feeling well, I'm feeling okay now. So is there any other treatment I'm supposed to continue again? And I really want to know what really if they have medicine to let it put stop to it.
Yeah, we coming to the treatment aspect. That's why I say keep listening to the show. We're going to answer your question because we're going to move bit by bit. So we're coming to the treatment aspect. We're going to tell you if it can be treated and how it can be treated, everything, please. Yeah? Thank you so much. Thank you for calling on the show. So, Alfonso,
Yeah, so like I was saying, children.
Yeah, we say under 15 years in Liberia.
Yes.
Yeah, children are mostly.
They are at risk of typhoid.
So what advice, what message do you have for them instead of the parents?
Okay, the reason that they are at risk of typhoid is that the symptoms in children are seen to be asymptomatic. And 2, children, they have a weak immune system. That is, they are in the developmental stage, so their systems are weak, therefore it affects them more. So my message out there is to tell the parents that whenever your child have fever, do not go to the drugstore to get a medication for that child's treatment. Go to the health facility. They will do a proper lab for that child and you will be able to treat that child. We should stop self-medication.
Okay, thank you so much. So Prince, listen to the caller. He said he wants to know, is there any medication for typhoid and can it be treated?
Yeah, typhoid can be treated. Typhoid can be eradicated from the body totally. and the drug of drugs for the drug of choice for typhoid is.
We are not going to call
No, I'm
drugs
not
name.
we're not I'm not calling any
Yeah,
drugs name.
or the classes. You can call the classes, but you're not going to
I
call
wanted to
specific
just
drug.
talk about the classes.
Yeah.
We can use antibiotics to treat typhoid, but we are not encouraging people to go and start doing self-medication. If the doctor have, give the medication, and if he have been taking the medication as prescribed, I think if there's any other thing, you can reach out back to that physician who ordered the drug, and then see how best. If there's any other thing that can be done, if he still feels sick, then the two of them can come to one conclusion as to how they can go along with the treatment. But I think to go on ahead after you have taking what have been prescribed for you, to go ahead and start buying drugs from the drugstore when you don't even know these drugs and take them by yourself, I think it's very, very harmful. It could be doing more harm than good for him. So he should get back to the prescriber of those medicines, the physician, whoever saw him, and then they both can sit down and have a conversation. If he still feels sick, well, they can do something about it, but you shouldn't go ahead and just buy your own stuff. And
Definitely. So once the doctor put you on the treatment and for certain length of time and you are feeling well, it's better to remain like that or go back to your doctor if there is any complication or you feeling any other symptoms in your body that you are not feeling before. But antibiotic is the choice of choice. Then one thing again, you should always wash your hands often. Right? Wash your hands often. Make sure that any fruit you buy on the street, before you eat that food, wash it properly, right? Avoid hanging over fruit. Like going to a restaurant, kobosha, any type of mineral water. Because I listened to Alfonso and you guys said this disease is an enteric. We either get it, in my introduction to ourselves, we either get it from food or water. So when you are diagnosed of typhoid, you need to be careful of what's going into your system. Because you need to make sure they are clean and the water that you are drinking is clean and pure. Don't just drink any type of water, and make sure that your area is clean, even ratchets. Make sure you clean your spoon and other things. So Alfonso, so time is fast spent. Can we just give you prevention tip and that of your party statement so we can start with you? Can you give some prevention aspect?
Yes, one thing we should understand is that by you having typhoid and being treated, the typhoid, you will be killed from the typhoid, but it doesn't mean that you won't come down with typhoid again. It's based on your environment. If you experience continuations of typhoid infection, you have to check your environment, your lifestyle, because you might be treated for typhoid and the water you drink is affected. Definitely after your treatment, after a few months, you'll go back to the hospital. So we should be able to check our drinking water, the food we eat, like they said, the fruits, and carry on sanitary habit, washing our hands regularly. Coronavirus came, we used to wash our hands, and right now we are feeling reluctant. I think we should still continue that in order to keep us healthy. So I want to say to people out there that we have to carry on good sanitary habits, and we have to pay attention to our children. Our children come from schools, they play. We should also teach them how to wash their hands, because they are risk more.
Okay. Thank you so much. Thank you. And we move to Mr. Connor. Mr. Connor, what message do you have for the people listening to you in that of your parting comments?
First of all, as it relates to prevention, I think my colleagues spoke a lot about it. You see, most people will complain about having typhoid and being treated, and then later on, they came down with it again. Sometimes, because of the mishandling of the medication, like what I was talking about, the self-medication, sitting at home and just buying your own drugs and treating yourself. There's something now called multi-drug resistance, and the typhoid bacteria is becoming resistant to those drugs that used to really work on them. So sometimes they will give you the medicine, you might feel that you're well, but if there's a possibility that that particular strain of the bacteria is resistant to that treatment. So as a result of it, you can feel that you well, the symptoms will go, but the bacteria inside can stay in the system, and then you can also be able to spread that particular disease to other people. So one of the main things here I think we should try to avoid the self-medication. That's one of the main issues I want for us to take from this discussion today. Let's avoid self-medication. Let's always practice seeking professional help first. And then whatever we want to do now, we'll base it on the help that we seek, and then we'll also do it in collaboration with our own health, with our trusted health practitioners. We should not just go about doing our own things, because it's very, very common in our country, and I think it's contributing widely to the spread of not only typhoid but so many other common diseases in Liberia. So I want all of us to pay attention to our health. Let's see professional here. Let's take care of the children, like my colleague was saying. These are people that are at risk, because they cannot, most of the time, they cannot really think as well as the adults do to be able to make their own decision. If the child can complain, you give the child food, definitely not open your hand and just eat. Until you, the parent now, can try to instill in him that particular or washing hand or procedure. So let us all try to pay attention to the children and try as much as possible to look after them, and then also look after our own health too.
Thank you so much. So to our brother that he said he was diagnosed with typhoid a few weeks ago, just few recommendations from you. If you are still listening to us, we advise that you go back to your doctor if you are feeling any other signs and symptoms other than the typhoid, and please ensure that the food you eat is cooked well and stay hot when you are served with it, right? Avoid raw milk and products made from raw milk. Avoid ice unless you are the one that made that ice. Meaning you pour clean water somewhere and take the ice, and you start to lick the ice or put the ice into your juice or whatsoever, right? When the safety of drinking water is questionable, to not drink it. If you feel that this water, if I drink the water, or because of the mineral water that I'm drinking, I'm always coming down with typhoid, I advise that you change your drinking water. So when you know that the water is not safe, don't drink the water, right? Wash hands thoroughly and frequently with soap. In particular, after contacting with pets or farm animal. So when you play with your dog, your cat, anytime you come in contact with pet, always make sure to wash your hands. Wash fruit and vegetables carefully, particularly if they are eating raw, like the apple, the grape. What we just take, we put it in our mouth, right? You need to wash it carefully and make sure that it is clean before you put it into your mouth. If possible, vegetable and fruit should be peeled. Like the banana, wash the banana before you peel it and eat it. So please, when you take this step, when you take this preventive step, by the help of the Almighty, you're going to be safe from typhoid. It can be treated. But when complication arises, sometimes you can even go for surgery.
Sure.
So we don't want to reach to that part. This is why, we take upon our time to keep spreading the message, to keep getting more awareness, to keep talking to people, to see how best we can get rid of typhoid. So I would like to take this time to thank the both of you for coming. Thank you so much for sharing your knowledge with us. Thank you for enlightening people on this important topic, typhoid. Because this time you can see in Liberia, people saying, I get my leg typhoid. It's not actually leg typhoid. You don't have to own this sickness, because this sickness is really dangerous. It can damage the intestine. When perforation causes in the intestine, they have to do surgery. So it's not leg. We have to make sure to see how best we can prevent this typhoid. And once you monitor your drinking water, the food that is going into your mouth, definitely you will conquer typhoid. But once you just eat any type of food, straight food, any type of cold bowl, because you don't know how the person prepared that meal, right? You're going to fall sick within that meal. So I want to take this time to thank you very much. Thanks to both of you for coming in studio to enlighten our people on this all important topic. I would like to take the time to thank the Hot FM family for always being with us and guiding us through our health process. And I would like to thank the Honorable DJ Blue for allotting us time in studio to always educate our people when it comes to these various health issues that are affecting us in our respective community. Thank you so much, and once again, I am Momoa Elume. Stay tuned, same time next week Thursday for another health edition. Thank you so much.
Begin at tuneslikebeyond.com.
We are project.